Well, welcome everybody. My name is Marty Mascari. I'm with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center. And the ADRC is a program under the North Central Texas Area Agency on Aging. We're blessed again to have Dr. Ron Mottern here with us to talk about mental health and the psychological burdens of the pandemic, the war, aging, declining health, and everything else that attacks us or weighs on us, I should say. But before we get started, I want to talk about this for CEUs, for those of you that are on here wanting to obtain CEUs. If we could go to the next slide, Doctor, and I'll go over the CEUs with y'all. Can we advance one slide?
Okay, I'm on the continuing education slide is what I'm seeing.
And you know, it's not coming up, so it's not moving on this side. Sometimes that happens and you just have to I've had to unshare my screen and reshare it.
Okay, let me try that now.
We're still on the banner, or at least that's what I'm seeing. Yeah, on both of my computers I'm seeing.
Okay, let me reshare it here.
Yeah.
See if that works.
Usually that solves that problem, but we'll see.
Okay, you can now see the application. What about now?
Interesting. No, it's still on the same slide here.
Not getting it. Let me go back and let me just. Can you see it now?
Now we can see it. That's exactly right. I can see it now. Yes. Very good.
I may just have to leave it like that with the stuff on the side instead of.
Yeah, sometimes it creates a problem. But that's great. And if not, I can. If it gets frustrating, I can share my computer and I can run from here if we need to. So, but for those of you that are on for continuing education units today, we're offering continuing education for licensed social workers and licensed professional counselors in the state of Texas. We're also offering certificates of attendance for any of you that want one of those. The guidelines will be the same for both of those. For those of you that are outside of Texas, I've had people tell me from time to time that they've got the certificates and their jurisdictions have taken them, but there's no guarantee of that. We're just set up to provide those within Texas. In order to obtain either of those, you've got to, first I should say it's 1.5 classroom hours is what's being offered today. In order to obtain them, you've got to complete the entire webinar. You can't miss more than about 5-10 minutes at the most. You must also complete the Google survey evaluation, and that form should pop up as you close out of Zoom today. If it doesn't, you will also receive that in the follow-up email that will go out with the doctor's slides probably tomorrow morning. And that will be a web link for Google. The Google survey will be up for 1 week, so it will be up until the 20th. And then give us the following week after that to get the certificates out. I don't even start sending, I do them all at one time. And so I won't even start before the 20th, but I'll get to them by the 27th. I should, by all means, get to them by then. So now if we could advance to the next slide. And I want to talk a little bit about Dr. Mottern, our speaker, and his background. Dr. Mottern is the executive director of the Mottern Institute for Mind Body Wellness. He's got 22 years of experience with in-person, and he does virtual worldwide treatment online, specializing in cognitive restoration. You're gonna have to
restructuring.
Restructuring, thank you. And my screen went blank there for a minute. Just totally went black. Okay, behavioral modifications, emotional regulation, and physical improvement. He's also authored a book called Living Well, A Guide to Cognitive Behavioral skills exercises. I will tell you, I have that book, and it's a workbook. It's great. So, Doctor, I'm going to turn it over to you if you want to take it from here.
Okay, thank you. I apologize for this stuff over here on the side, technological difficulties. We will carry on. I always like when Marty sends me the topic and it has etc. in it. I don't make up those topics myself. Marty does those when he sends it to me and it says etc. That means that I can add whatever I want to in there on that. So hopefully we haven't gone too far afield today. My pleasure to be back once again. Always enjoy doing these things. Today, what we want to look at is we want to look at some information on mental health and the pandemic and mental health and war. You know, the pandemic sort of was fading out there for a while, and then we had the war in Ukraine. So we want to look at that. Some stuff on mental health and aging, the idea of cumulative stress, which is what all of that adds up to, and then what can I do about this? And hopefully we'll have some time for a little practice of that, some wellness at the end of it there. So that's what we want to do today, and we'll go ahead and jump in. And you know, when I'm researching, I just recently left the state of Texas Health and Human Services Commission, the Disaster Behavioral Health Service, where we were working on a grant, which was the COVID-19 grant. And every time I look up research on COVID-19, this is what I see. All the research starts with something like, you know, an unprecedented detrimental impact on mental health and people around the world. That's what we see whenever we look up that research. However, when we actually look at the research, we get a little bit of a different story, right? Robinson in his research just recently came up with something that it said that, you know, mental health issues sort of spiked at the beginning of the pandemic, and then later on, now they have fallen to about pre-pandemic levels. So there's some caveats on all of this. Of course, there's always caveats on it. So that's why there's lots of research out there, right? One study did it all. We wouldn't have to look at anything else. But in general, it's now fallen back down to pre-pandemic levels in most cases. He found that there was a significant but small increase in the mental health symptoms early on, but by about mid-2020, those symptoms have come back down to pre-pandemic levels. Of course, he found larger rises for depressive symptoms. That's something we continue to see. And also people with existing health problems, physical health problems, were also affected by that. So that's something we continue to look at as well. So overall, in 2020, what we found is that we are very resilient creatures. Okay, even though we have this major pandemic that's going on, we fared fairly well as we went through these things. Some of the other research that's out there looked at populations who were predisposed to mental illness, and they were more affected by the pandemic than most people. And also these particular categories of people. If you were young, you tended to be more affected than older people. You were female, ethnic minorities, and if you had a predisposition, if you were predisposed to loneliness, then that was also something. And once again, physical and mental health related factors that might have existed pre-pandemic were also affected more by the pandemic. But those special populations right there were especially affected as we went forward. Other people have done longitudinal studies on adolescents. And, you know, adolescents are an interesting group. They sort of throw a fly in the ointment of all research, right? So in this particular caveat, when we look at adolescents who already have mental health problems, okay, what they found was that those who had a high clinical severity of mental health problems going into the pandemic, the clinical severity of those problems actually decreased during the pandemic, okay? And the things that they measured for them were things like depression, anxiety, stress, things that generally went up for other people. For this particular group of adolescents, went down. Also looked at oppositional defiant disorder, psychosis, and suicidality, things which you would expect to go up in something like that. and then here they are, they go down in this particular group. So I say this just to throw out there that we have to be careful when we're looking at the research that, like I said, there's always caveats to this, and we want to, in this particular group, this may be, in another particular group, it may be as well, something else. So we want to look at that. But overall, pretty much what we found overall was at the beginning of the pandemic, there was a spike. And then as we went on, and once again, this is in adult populations, to throw a caveat out there, that the mental health systems, especially depression, anxiety, loneliness, those increased at the beginning of the pandemic, and then they dropped to pre-pandemic levels about mid-2020, and that's about where we are right now. Once again, I think that's sort of hopeful in that what we look at when we see those things is that we're very resilient creatures, and we can deal with these things. Of course, like I said, the populations most affected by these were already predisposed to mental health issues. And in young adults from 18 to 20, this was a daily doom scrolling. And if you're not familiar with that term, that's a new term, right? Doom scrolling, which is a surge in negative emotions caused by repeated exposure to social media, okay? And it doesn't just have to be about the pandemic. Now it's about the war and everything else. But those who had daily doom scrolling going on their social media, those are the ones we saw people who had increases in depression and even PTSD during those initial days of COVID-19 when they were doom scrolling about COVID. However, the research that we're looking at now, it says that spike that we saw right at the beginning of it in mental health issues seems to be related to lockdown, seems to be related to social isolation, that those mental health issues started to go up, especially the depression things, some mood disorders and what have you, but depression especially seemed to go up when we went into social isolation. So that's what the research is showing now, really on the pandemic and what's going on with that. Because once again, we have to sort of search, we have to look for these things because we don't always find them straightforwardly in other venues, right? So sometimes we have to look at that. And if that wasn't enough, if all of those things weren't enough, remember that we also had pandemic grief, right? Which was a new thing, right? Just came out, it was just defined in 2020. That pandemic grief is a dysfunctional type of grief due to COVID-19 loss. And this was very interesting. Now, if somebody, and we're talking about people who died of COVID-19, right? This is the pandemic grief. Not somebody who was killed in a motorcycle accident and was then later said to have COVID-19. And a lot of that going on. Once again, we have to be very careful when we look at the information on what we're looking at, right? But pandemic grief was characterized as grief caused by a COVID-19 loss, and it had 5 really significant constructs that were in it. Suicidality, which is one, and it shares some of these with other types of grief as well. But suicidality, identity confusion, really who am I after the loss of a significant other, right? Reminiscing on the negative, which is that inability to recall positive moments or positive memories of the deceased. So in this, that's a very interesting thing. In other forms of grief, I have a problem looking at those sorts of things, but that inability to recall it is something that's very interesting in pandemic grief. And then that meaninglessness that goes along with that loss, and then apathy. And apathy is really the significant construct in pandemic grief. But this is something else that we had to deal with, right? Not only did the pandemic sort of exacerbate all of the other problems that we have, we know that, initially substance use went up. Now, substance use disorder, I haven't seen any research that said that went up, but definitely substance use went up. These different things, different coping mechanisms, right? We saw more of those as we went forward. And then we get something like pandemic grief. And don't think that the grief issues that we have are just for people who died from COVID-19, right? We know that anytime we have a disaster, okay, that the grief experienced during that disaster period is going to be more intense than grief outside of a disaster. So, disaster grief is not really a diagnosis, right? But this is what we know. We know that the grief experienced during a disaster, caused by a disaster, is more intense than grief outside of disaster periods. So the pandemic grief, if you lost someone during that time, certainly that could be something you're experiencing as well. But also, even if you lost somebody that didn't have to do with COVID-19, then you may be experiencing that more intensely than normal. And this is with some of my individual clients in my private practice. I've seen who lost parents and things like that, not to COVID-19, but to other things. And that intense sort of grief is very troubling for them, even now, even over. I think I have one client who lost their mother a little over a year ago. So still experiencing some intense grief on that and what have you. So like we said, this pandemic has affected us in many different ways that we can, sort of all aspects of our life. And then it sort of faded out, right? It was sort of fading down. We sort of went through the variants and people were starting to, open back up and say, make personal decisions on what they thought was best for them and their families and what have you, as opposed to being forced to do it like we were initially. But then just when that started to happen, what do we have? We have the war in Ukraine, right? Just when you thought it was safe, now we have that war in Ukraine. And what we know about things like this, once again, we use that disaster proximity model, right? And with disaster proximity model is that if you're at the epicenter of the disaster, so if you're in Ukraine, if you're in that particular area, you're going to experience that disaster with much more intensity than you would as you get further away from it. But just because you're further away from it doesn't mean that you're not going to experience it. Okay, so we're still going to experience some of that, even though the war is, in Eastern Europe, it's over there on the other side of the world just about, then we're still going to experience it here. And a lot of that has to do with this doom scrolling stuff that's going on. Once again, that so-called doom scrolling, it's just a surge in negative emotions caused by repeated exposure to social media stories about whatever the distressing event was. When the pandemic was the main thing, it was people doom scrolling with the pandemic stuff, and still some of that going on. And now that we have the war in Ukraine, then people are doom scrolling about the war in Ukraine. Okay, and this is sort of adaptation, right? It's sort of something that we do in order to try to gain control of our own lives. We don't do anything as a pattern of behavior that doesn't meet our needs in some way. We try something doesn't meet our needs, we just do something else. We don't pick it up. If we're doing something as a pattern of behaviors because it works for us at some level. It may not be the best thing for us, but it's meeting a need in some way. And that's exactly what doom scrolling is. Even though we're finding that it's bad, very bad, okay, what it is it's an attempt to control what's going on in our lives, right? So we think, well, the more information that we have, then the better off we are. I can make better decisions in my life the more information that I get. So we do this doom scrolling and try to get all the information that we can. And what we have is we end up getting depressed over all of this stuff, okay? So the war in Ukraine is a long way away, and yet we're still affected by it. With social media, we're there right now. We can get this stuff instantly. It's not even like in the old days of television, right? When it had to go back through television, somebody had to review it. These days, we don't have to do that. These days, somebody can be over there filming and we can be watching it right here. So that puts us much emotionally closer to what is going on in those places, even though we're, half a world removed from it, a third of the world removed from it. We still experience those problems, those emotional problems. I've read some stuff with younger people even experiencing PTSD symptoms because of what's going on in Ukraine, right? So this is something that we have that's going on that is causing us all kinds of problems. So not only did we have the pandemic, and now we've got that BA2 variant, right, which is spreading of that. So we're still talking about some of the variants of that. We're still talking about some of the pandemic in some respects, and now we have the war on top of that. And you know, just how much do these things affect us? Well, they just came out, okay, just sort of last month. They had a Stress in America survey that's conducted by the APA and the Harris poll. And this is some of the things that they found. They found 81% of adults that were polled reported feeling stress caused by global uncertainty, okay, what's going on in the world. 80% experienced stress from a war in Ukraine. Once again, that social media puts us right there. We're right there with them emotionally and what have you. And then 80% feared some sort of potential retaliation from Russia, either cyber attacks or nuclear threats or what have you. Now, those of us who lived through the old enough to have lived through the Cold War, right? This is sort of a devil we know, right? We were familiar with the Russians, and we're familiar with the games the Russians played and what have you. Not to underestimate them, right? But at the same time, it's something we're familiar with, but younger people haven't ever been through this, right? They're living in a world where this sort of thing is causing them lots of stress as we move forward. So we have that, and then what do we have as far as mental health and aging? Well, like we talked about previously, what we're finding in the research now is that a lot of the mental health problems that caused that initial spike were actually related to the lockdowns. We're also related to that social isolation, that loss of independence and autonomy that we had. We've done a whole session on this before when I've been here, but some of what we know, I mean, we know as we get older, we lose some independence and autonomy, right? Especially in cases of dementia, Alzheimer's, things like this, Parkinson's disease, these sorts of things. As I have these, I'm going to lose some of my mobility, and as I do that, or you know, some of my cognition, and as I lose these things, then I'm going to also have a loss of independence and autonomy. But what we also know about this is losing that autonomy, losing that independence can also cause mental health problems, okay? Works both ways. When we lose our, you know, mental health, then we'll lose some autonomy, but also as we're moving forward in our lives, when we lose that independence and we lose that autonomy, then we're also going to have some mental health problems. And there's been research on this. Up there, Albanese and his research group found that the loss of independence in activities of daily living were associated with a significant decline in mental competence, okay? They found this was back in 2020, they were doing this. I haven't seen any research on this specifically related to the pandemic, other than that we know that the research that's coming out now says that the mental health spike was probably due a lot to the loss of that independence, right? But this is some research that was done before. Same thing, Escaro and his group looked at the perceptions of older people. I believe this was done in Australia, that were living alone. They're at risk of losing their independence. And they found that when they lose that, especially driving, right? I mean, you know, the Australians are much like us in that respect. In America, you know, the car is the big thing. The car is symbolic of independence, right? When I get the keys to the car when I'm 16, I'm gone, right? So apparently the Australians are much like us in that respect. And what they found is that it was very troubling for them when they had that loss of sort of independence, that loss of autonomy, when they had to give up the car keys as they got older and what have you. And also that social isolation after the loss of a partner also contributed to mental health concerns, such as anxiety, right? Now, certainly we have grieving, we have that sort of stuff going on, but a lot of this was anxiety caused by the loss of that life partner and what have you. So we see mental health concerns arising from the loss of independence itself, okay? And a lot of this has to do with perceived control, okay? Excuse me. We know that the more control we think we have, then the less stress in our lives we experience. And stress can exacerbate all sorts of things, depression, anxiety, etc. And we'll talk about that in a minute. But the more control we think we have over our lives, then the less we have these problems. However, the less control we see ourselves as having, then the more stress we're going to have in our life. And that perceived control is very important. We know it moderates the health effects of traumatic stressors. We know that it mediates the effects of socioeconomic status and other chronic stressors as well. So as I age, and as I, as long as, if I can hold on to those car keys, that gives me some sense of independence. I may put up with a lot, but I can always go get in that car and go, right? Gives me some sense of control over my life, okay? But when those keys have to go, when it becomes time that we have to do that, not only for, our loved ones' safety, but, other people on the road safety as well, then that's going to be traumatic, right? It's going to be very traumatic to that. So we see this stuff going on, right, as we get older. And all of us are, we started with the 2019, right? Now it's 2022. So we're all a little older, right, as we've moved forward in this. And as we see these things going on, it's just one thing after another that really adds to this model of cumulative stress that we have. Now, cumulative stress is a term that we came up with when I was working at the state. It's differentiated from chronic stress. Chronic stress is any stress I have over a period of time, right? Clinically, usually that's about 6 months. But we're all pretty good at dealing with chronic stress in our lives. But cumulative stress is something that happens when chronic stress gets piled on top of chronic stress, gets piled on top of chronic stress, and that is some of the stuff that we're seeing happen these days. All of those things that we just looked at were major chronic stressors that have been piling up on us over the last few years, okay? So if we look at the, that figure there, that's what we see. If we look at that sort of blue line that on the x-axis there, that's sort of chronic stress. So chronic stress, it'll go up. And as we implement stress management, it'll go back down, and then, it'll go up again. So we get to implementing we feel when we're getting stressed, or I go run, or I go lift weights, or whatever it happens to be, right? Go exercise, okay? And it goes up and down. So we sort of get that sort of flat line there as we look at that, draw that through the middle of it, right? We get that chronic stress. But what we have with cumulative stress, and that's the red line, is that we have that chronic stressor, which causes our stress to increase. And then before we can do anything about it, we have another chronic stressor, right? We have, we have all of the chronic stress of living, of normal daily living. And then on top of that, all of a sudden we have the pandemic. So that goes up, and that's, one thing after one variant after another. All this other stuff that we're told, we don't know what to believe. We don't know what, what's true, what isn't true. We just have to make our own decisions on that a lot of times. But we think that's getting ready to come down. And then what happens? By golly, we have the war in Ukraine and global instability, right? So we have that's on top of us then. And that's still going on as we all age, as we all get older. So we have these chronic stressors piled on top of chronic stressors piled on top of chronic stressors, and that is cumulative stress. When we talk about cumulative stress, that's what we're talking about. Recently, I had someone ask me, well, what's the baseline for that? How do we know when we're at cumulative stress? And really, my answer to that is that, well, we know it when we feel it, right? We know that, and when we look at some of the things that are going on, especially in the workplace and what have you, now we're getting to see that cumulative stress among people who are very good at dealing with chronic stress in their lives. Professionals like doctors, nurses, therapists, these sort of people who have to deal with chronic stress and intense, not only chronic stress, but acute stress on a daily basis, right? A daily basis of acute stress would give us chronic stress, right? But they're pretty good at dealing with that in their lives. What we're now seeing is those people are starting to burn out, right? doctors, nurses, and in 2021, I believe it was, in 2021 was the first time that nurses had surpassed doctors in burnout rates. Okay, so usually it was the doctors had a higher one than the nurses, but in 2021, the nurses, certainly not a race you want to win, right? But they became got higher than the doctors did as far as burnout rates did. So not good. So that's sort of the baseline, right? What is cumulative stress? How do we know when we're there? Usually when those of us who are pretty good at dealing with chronic stressors in our lives, when we start to burn out, that's when we're realizing that we're into something different, right? Something different in our lives. And I just wanted to go over a few things, okay? Once again, going back to that Stress in America poll, okay, and looked at the things that came up on that, okay? And that's just, like I said, that's just recent. That's just like last month, okay? The end of last month that came out. So we're starting to look at that now. And what we're finding is that inflation and issues related to the invasion of Ukraine are significant stressors. So once again, another chronic stressor. What's another? We've already looked at the war in Ukraine, but what's another chronic stressor? Inflation, right? What's going on? The gas prices, right? And not only that gas prices, but also food prices, supply chain issues, these sorts of things. So this is what we're seeing, you know, inflation, gas prices, grocery costs, energy bills. People were at 87% of the people who were polled were stressed over that, okay? Supply chain issues, 81%. You know, I grew up in the 80s. In the 80s, if you'll remember, those of you who are around, you know, the 80s were the decade of customer service, right? For the one time in our lives, the customer was really always right in the 80s, right? We could wheel and deal with people. We could get what we wanted. It was sort of a unique time. But now I can't get chicken wings, right? I go to buy, there's no chicken wings out there, okay? Well, why can't I get chicken wings? Supply chain issues, okay? But 81% of the people were stressed because of these supply chain issues. Global uncertainty, once again, was at 81%. And, you know, 61% of the respondents in that poll said that their lives had been forever changed by the pandemic, okay? Forever changed by the pandemic. So that's pretty significant. 87% said felt that there was a constant stream of crises over the past 2 years, which indeed there has been. That's the cumulative stress, right? That's the cumulative stress model we have. Constant crisis on top of constant crisis on top of constant crisis. And then 73% said that they felt overwhelmed by the number of crises that they were currently facing in the world today. Once again, that points at this concept, this idea of cumulative stress, okay? I don't want to get too much into that. I've done presentations on that before here. I'll be happy to do it again. But I feel it incumbent upon me as we talk about these brand new poll results that we have out to sort of go back and sort of look at just how bad stress is. Okay. You know, I just posted something the other day on people are always saying, well, so why do you focus on stress so much? Why do you look at stress management so much? And this is the reason, right? This is the reason that I do this. And stress has a terrible effect. I mean, everybody knows stress is bad for you, right? Distress, right? We have eustress, which is positive stress, but we're not talking about that. The distress that we have in our lives is very bad for us, and people forget just how bad it is. Okay, so one of the things that they forget is that chronic stress does things like it atrophies our brain. Okay, acute stress prevents neurogenesis, which is the formation of new brain cells, right? New neurons in the brain. So this is where we get that saying, stress makes us stupid, right? Because stress reduces the volume of the hippocampus, and the hippocampus is learning and memory. So chronic stress will atrophy that hippocampus. So we have problems with learning, we have problems with memory. You know, one of the things that I've sort of noticed as we've moved forward in the pandemic over the years is that people have a lot of memory problems. People have a lot of, you know, their thoughts are fuzzy. That's one of the characteristics of some of the things that are going on. but we have these sorts of things going on. Well, that can be expected due to the amount of stress that we're under. That's not just unique to you, right? You're not the only one who might have that problem. And that's what I'm always telling people, right? No, it's not just you, right? This is something that's going on around the world with people, because we're under such a high amount of stress, that we're under that cumulative stress, which is causing physiological effects in the brain. Also, we know that stress reduces the volume of the medial prefrontal cortex. That's that reasoning part of that's what makes us human, right? Separates us from animals, right? Is we can work things out, we can reason and do things like that. That is also affected by that. So we know that stress during, okay, well, I can do that. Okay, stress during pregnancy, for those people who may have, become pregnant over the last 3 years or so, we know that stress during pregnancy can produce neurological, emotional, cognitive, behavioral setbacks in the developing fetus. We have some good research on that over the decades. One is the Dutch hunger winter study. The Dutch hunger winter was when the Nazis tried to starve the Dutch during 44, 45, that winter. The Dutch went back and they studied people who were pregnant during that time, who gave birth during that time. They studied the individuals who were born, right? And this is what they found. That they found in the development, what they saw was unsocial behavior, ADHD, sleep disturbances, psychiatric disorders, depressive symptoms, substance use disorders, mood and anxiety disorders, even personality disorders in that population that was born or conceived during that particular time, because the fetus is awash in the stress hormones of the mother. Fetus has no protection from stress, right? We can do things, right? We can do stress management, we can work in our perceived control and things like that. Fetus doesn't have that, doesn't have those skills, okay? So they're just at the mercy of the stress hormones. And we know that this is what happened in that particular case. And, I'm sure that there's some research going on in that area right now, sort of looking at the stress we've been under with the pandemic and everything else, and then doing a longitudinal study, really following those children who are born over a period of time, and we'll probably see the same things. This is well-researched stuff. We also know stress does things like suppress the immune system and opens individuals with higher stress to various health-related diseases. An example of that would be gastric ulcers. We used to think that gastric ulcers were directly caused by stress. Then we found out that gastric ulcers were caused by a bacteria, right? That Helicobacter pylori bacteria. In fact, if you think you have an ulcer, gastric ulcer these days, your doctor will just take a sample, he'll send it off. If it comes back with the bacteria, then you get a pill, right? And that takes care of it. However, we also found out that about 3/4 of the people in the world had Helicobacter pylori in the gut, but 3/4 of the people do not have gastric ulcers. So we said, what's going on there? And what we found was that when we get stressed, stress suppresses the immune system, which keeps that bacteria in check. And as the immune system is suppressed, then that bacteria is allowed to run wild, and that's when it starts eating the stomach lining out and things like that. So that's, stress, we know, and when we suppress the immune system, gastric ulcers are just one example, okay? There are others. We know that college students, right, tend to get sicker a couple of times a year. One is at midterms and one is at finals. And that's not by choice, right? Although some professors might think so. That's just because they're under an intense amount of stress that lowers the immune system, that opens them up to various viruses and what have you. So that's going on. That's caused by stress. Stress produces cortisol in the body, which increases weight gain, which leads to diabetes. And diabetes is its term, it's diabetes and obesity, right? So we start to gain weight, but you get that diabetes, and then also that develops in cardiovascular disease, right? Not only the ischemic heart disease, but peripheral artery disease as well. And let me just throw out here that remember that Alzheimer's disease is now considered type 3 diabetes, right? So if you haven't heard that before, That's been around for a while. That's not something that's particularly new, but Alzheimer's is considered type 3 diabetes these days. So stress, not good. Stress is not good for us, right? We know that physiologically, then our entire system is affected by stress. The autoimmune system is affected by stress. That autoimmune system, we're talking about inflammation, right? Pain, inflammation in the body is going to increase as I get more stressed, as that stress starts to affect the autoimmune system. That's what's going to happen. The gut microbiome is going to be affected by that. That's the gut-brain relationship. And that gut microbiome, what we've known for a number of years now, is that the gut microbiome and its health is intimately related with mental health as well. Okay, which isn't really surprising because 90% of the serotonin in the body is contained in the gut. Okay, through that gut-brain axis, through vagal nerve stimulation, it's moved up into the brain where it's put to use. But once again, this cumulative stress from all of these things that we're experiencing is not good, has very bad effects on us. Okay, why do I talk about stress all the time? This is why, because stress affects the reward processing in the brain. Stress causes biochemical hormones in the body to increase. Cortisol is one of those, and as I increase in weight, I'll tend to deposit that fat which is developed into unhealthy areas of the body, particularly in the abdomen, because fat that's carried around the abdomen causes other hormonal changes as well. So it's not just the cortisol, it's where I carry the fat that's produced by the cortisol, and then I have other problems going on from there. We know that stress also interferes with the cognitive executive functions in the brain, decreases self-regulation, and that means it promotes eating and other compulsive behaviors. So when we talked about the pandemic and COVID, the COVID-20, right, that 20 pounds that we seem to gain during this, that most people seem to gain. Some people lost weight, some people gained weight. But what this does is stress interferes with those cognitive executive functions. I want to eat compulsively, and I also want to eat foods that are high in calories. I want to eat sugars. I want to eat bad fats. I also want to decrease my physical activity and shorten my sleep cycle, all of which are bad for me, okay? So why do I talk about stress? Well, because stress is a major contributing factor to some very bad things that happen to us. So just to sort of sum it up there, what are some cumulative stressors that we have on us right now, right? What are this cumulative stress? What are some of the things that are affecting? COVID-19 still going on, right? Continuing variants, that BA2, which is an Omicron variant. We have to worry about, that's getting out in the news now, that's coming out. We have the loss of our basic freedoms, some of which we haven't got back yet, okay, that affect our autonomy and independence. That causes mental health problems. Social isolation most certainly causes mental health problems as well. We have the war in Ukraine, and let me just throw in that before even COVID, we had civil unrest in the United States. We had quite a bit of that. Portland, Seattle, New York, Philadelphia, different places across the US. We were seeing civil unrest, places burned, people hurt, these sorts of things. So that was going on even before COVID-19 hit, if you'll recall back. Sort of hard to remember back that far, but that was going on as well. Now we've got the war in Ukraine. The economy is not doing so good right now. Inflation, supply chain issues, all of this stuff going on. So, we seem to be in a pickle, right? So what can we do about this? All this stuff is going on. Do we just crawl under a rock, put our heads in the sand, maybe throw a blanket over us and just go to sleep until it's all over with? No, there's some things that we can do, okay? If I feel out of control in my life, what I want to do is I want to focus on the things that I have control over, okay? Now, the Stoic philosophers, they've been around for a long time. Even Socrates is sort of a proto-Stoic, okay? But they've been around for a long time, and they long ago said that all unhappiness in life comes from trying to control what I have no control over, okay? Wives, think of your husbands. Husbands, think of your wives. Right? Everybody think of their children, right? It's just, all unhappiness and less because of me trying to control what I have no control over. And really, the only thing that I have control over is what I choose to think and what I choose to do. Those are the things that I have control. I don't have control over what anybody else does. I don't have control over what the government tells me that I have to do, okay? Now that we're approaching tax time, right, that's especially relevant perhaps for some of us. But these things that somebody, the government decides this is what's going to happen, my local government institutes these sort of mandates and these sorts of things, then I have no control over that. I have control over what I choose to think about them. I have control over what I choose to do about them, okay? But that's all that I have control over is what I choose to think and what I choose to do. And as long as I focus on that, that's what I want to focus on, okay? The government says I have to pay taxes, okay? I don't want to get in trouble with the IRS. I've already paid my taxes. But the government says I have to pay taxes. I may not like that. So I focus on what I do have control over, right? I do have control over little things that I do around the house and things of that nature. That's what I want to focus on. Anything that I have control over in my thinking and my behavior, okay? I pay my taxes and then I go on a picnic, right? Because I have control over the picnic, right? I don't have control over the others, but I have control over this. So that's what I want to do. Focus on the things that I have control over. Now, when we talk about, I have control over my thinking, that's where I use that perceived control, right? That's where I can look at things and change that sort of perception and come away with a better sense of perceived control on things. Another thing, what can I do? Well, I can practice compassion and self-compassion, okay? And this is just a little model of, pity is I feel sorry for you, sympathy is I feel for you, empathy is I understand your feelings, right? I have the same feelings that you do. We're all human beings. We all have the same library of emotions from which to draw. But then as compassion is I'm here to help you. So what can I do to help other people during this time? And what can I do to help myself? Okay, those are some things I want to look at. Focus on what I have control over. And part of that is me being compassionate. So how can I be compassionate? How can I help other people? And also, how can I help myself, right? That's always sort of a, charity begins at home sort of thing, right? I need to focus on me before I start helping other people. Excuse me. This is the same thing, when you get on an airplane, put your mask on first before you try to help other people, because if you pass out, then you're not going to be able to help anybody. Put your own mask on, then help somebody else with theirs. Same sort of thing. What can I do to show some self-compassion for myself? And then how can I help other people as well? Also, we know that if we want to reduce stress in our lives, we can maintain a healthy diet. Remember, stress makes us want to eat bad things, and eat all the time. But maintain a healthy diet, get quality sleep because stress interrupts that sleep cycle. Have positive social interactions, okay? And this can include something, we'll cover those in a minute, but this can include something like, calling somebody or emailing somebody, texting somebody, okay? It doesn't necessarily have to be in person. In person is always better, but at least reaching out to other people, maintaining those positive social interactions. Spend time in positive environments, right? Especially that include green space, getting outside, getting into nature is always helpful, especially in reducing stress. You can do it around water, it's even better, okay? The positive ions in the air help us there, okay? And then engage in regular physical exercise, because remember that when stress starts to affect the brain, I want to decrease my physical exercise. So now what do I want to do? I want to make sure I engage in that regularly, okay? Not sporadically, but regularly as we go forward. Some other things we can do, and this is sort of what I was talking about previously, and we want to do these things for at least 21 days. If you're starting them today, do them for 21 days, okay? These is part of the evidence-based practice. It shows that increased positivity rewires that brain for more happiness in our lives and what have you. Write a 2-minute positive email every day. When you go in, you get up, write a 2-minute positive, spend 2 minutes, that's it, 2 minutes, writing a positive email to somebody. Don't do your mother more than twice, okay? So make sure you're looking out to other people, okay, to write that positive email to. Spend 2 minutes writing in a journal about a positive experience that's happened to you in the last 24 hours, okay? So you'll see these are sort of things that make me focus on the positivity, right? So I have to be looking for those sorts of things. And you may find that that's exactly what happens. I get up during the day and I'm looking for, okay, what's the positive thing that's going to happen for me? And this will be it, right? So I'm able to find it. I'm able to look at it, find it, and I can spend 2 minutes writing in a journal about it. I can write down 3 things that's happened to me that I'm grateful for within the last 24 hours. I can spend 2 minutes in mindfulness meditation, okay? And then 10 minutes of physical exercise, okay? So for less than 20 minutes a day, if we did all of these things, for less than 20 minutes a day, I'm helping to rewire my brain. I'm reducing my stress. I'm increasing my positivity and happiness in my life. These are some concrete things that we can do, okay? Also, we have some other skills that we can practice, okay? These are part of the evidence-based practices in cognitive behavioral therapy, but one is diaphragmatic breathing. We can do that. And most of these things you can look up on YouTube, okay? You look them up on YouTube and they'll show you how to do them. Just type them in. You'll come up with lots of videos on these things, especially if you're doing the guided visualization, hundreds, if not thousands of guided visualizations out there. Find one that you like, right? Find several that you like. Try a different one each day. There's enough out there you can spend the next several years doing a different one each day. And they're always being created, so the number just keeps going up on it. Same thing, progressive muscle relaxation. Type in progressive muscle relaxation, and you'll come up with hundreds, if not thousands, of videos that take you through some of these things. And many of these things you can use at the same time, right? I can be using my diaphragmatic breathing while I'm doing a guided visualization with progressive muscle relaxation, right? So I can get all of these things working in synergy with me, right? Working together. Another thing, Relaxation Response. This was created by Benson in the 70s. It's a scripted performance, and I have provided in the appendix to the slides as we go through, if you get the slides, a link to the Relaxation Response, a link to that from his book on how to do that. It doesn't take very long. I've also provided a link in the appendix for Autogenic Training. Autogenic Training is going to take some time. Autogenic Training is part of the evidence-based practice that helps me to relax, reduce stress, fight this cumulative stress that we have going on. But it's going to take a little time when I do that. But that provided a link to that as well. What else do we have? Mindfulness-based stress reduction. That takes 45 minutes. Okay, if you've got 45 minutes, the research is certainly out there on that this is effective. Okay. But it's a system, and so it takes 45 minutes to do it. There's nothing magic about that 45-minute number. We've done research on that as well. That's just what John Kabat-Zinn was doing when he created this program. So that's what it is for the program. 2 minutes of mindfulness meditation is going to, for 21 days, and you're going to see results on this. Okay, you do it for 45 minutes a day, that's great too. But 2 minutes is all you need. Okay, Transcendental Meditation, the same thing. It's a system, so they do it in a specific way, so you can look that up. But any sort of meditation will probably work pretty well for you if that's where you want to go with that. The EFT, the tapping, the emotional freedom techniques, the tapping is something that I use anytime I have a client for stress management. There are 2 things that go on their treatment plan, at least 2 things. One of them is diaphragmatic breathing. The other one is the EFT tapping. That can also help with many things. It can help with pain and things of that nature. It can help with anxiety, depression. It can help with these sort of things. Once again, it's part of the evidence-based practice, but it has many different applications. And I have to remind clients that don't just use it for one thing, use it for many things, okay? So we have that. Cognitive behavioral therapy, that's the therapy of choice these days. Cognitive restructuring is sort of the what you do in cognitive behavioral therapy. We do cognitive restructuring, which is just changing the thinking, right? Sometimes that has to do with identifying thinking errors that I'm using and replacing those, or faulty sorts of beliefs that may not be healthy for me. Can't really flip the belief, but I can modify the belief until it reduces the harm that it causes. But there are some things out there. Byron Katie is a person, maybe familiar with her. She has something called The Work. Once again, you can go to YouTube, you can find videos on her doing her work with people who come to see her, and you can go to her website, which I've also provided a link to. She has something called the 4 questions that is straight cognitive restructuring, okay? Now, she doesn't call it CBT and she doesn't call it cognitive restructuring, but having done those for 20 years, let me assure you that's exactly what it is. But it's a very simple little process that she has, and that's the reason it's so popular. Is it's simple to do. She's laid it out fairly well. So I have a link in there for that. And then biofeedback techniques or something. I use one called HeartMath. There are others, lots of them out there. You can use, just look it up on Google, and there'll be some advertisements for different types of biofeedback machines and what have you. You can get. Those will be useful for you as well. So. What I want to do right now is I've done this before, and I want to do it with this, especially as we end up talking about this and all of the problems that we have. I do read the comments that people make on the presentations that I do, and I know that many of you tune into these things because you're looking for something, right? You're looking for help on these things. You want to get some help. So I want to practice some of this. I want to practice a guided visualization exercise. And those of you who are here for CEUs, I can hear the groans and moans from there. No, you need it too. In fact, you probably, based on what we know, you probably need it more than everybody else. People who are in the helping professions like to help other people, but they don't like to help themselves. So that's where we get on the backside of the stress, right? Is we end up, we help other people and we don't help ourselves. We don't put our own mask on before we help other people. So, so everybody I think can benefit from this. So if you would, okay, we're just going to go through a little guided visualization exercise here. So progressive muscle relaxation, okay? So if you would just lean back wherever you are. If you're sitting at your desk, just lean back in your chair. If you can hear me, if you're at home, sitting in your chair or wherever, just lean back and start to relax by starting doing some deep breathing. Now, if you know how to do the diaphragmatic breathing, do that. But do some deep breathing, abdominal breathing as you inhale through the nose, push that abdomen out. And then as you exhale through the mouth, just let that abdomen come back down, okay? Now, you can do that, maybe easier to do that if you visualize that there's a balloon in your lower abdomen, and as you inhale through the nose, that goes straight to that balloon and starts to inflate it. And then as you exhale through the mouth, then the balloon just deflates, okay? But just start that deep breathing in through the nose for a count of 4, hold it for a count of 4, and exhale through the mouth for a count of 8. And you can count as fast or as slow as you need to do. Okay, I have people oftentimes that I can't exhale for a count of 8. Well, speed it up, because speed up your count. You're the one who's counting. You're in charge of that. Just do it where it's comfortable for you. Okay, don't want to cause any more stress than we already have. So in for 4, hold for 4, out for 8. And as we begin, you don't have to focus so much on the counting part. Just make sure that that exhale is about twice as long as the inhale. When our exhalation is twice as long as our inhalation, that slows the heart down. That helps us to relax, okay? So continue that breathing. If you would, close your eyes as you're doing, if it's safe. If you're driving, don't do this, okay? If you're driving, do the breathing, but don't close your eyes. But anybody else, just go ahead and close your eyes if you would. And just, as you inhale, tell yourself to relax. And as you exhale, tell yourself deeper. And now actually do that. Actually allow yourself to relax deeper. Going deeper and deeper and deeper. Feel a wonderful state of relaxation and calmness with each passing breath. And as you continue to breathe, as you continue to tell yourself to relax deeper, now imagine, visualize, see in your mind's eye that right above the top of your head is a container. And this is a very interesting container because it contains a very precious liquid, okay? And whatever this liquid touches causes whatever it touches to become perfectly relaxed, perfectly calm, and perfectly peaceful. So if you would, imagine that that container is tipping over, pouring a thin stream of that precious liquid right onto the very top of your head. And as that liquid begins to spread over the top of your head, all the scalp muscles underneath it begin to relax. Feel that liquid as it flows down the front of the head, down over the forehead and the eyelids, over the nose and the cheeks, over the lips and the chin, allowing all those muscles to become calm. We know that any place we concentrate our mind in the body, that moves blood to that area. Blood carries oxygen, and the more oxygen the muscles have, the more relaxed they become. So visualize and feel that liquid as it flows down the sides of the head, down over the temples, over the ears, flowing down over the jaws, where we often carry tension in our body, causing us to grind our teeth or clench our jaws. Now any tension that's there simply disappears as it's replaced by that precious liquid. Feel it flowing down the back of the head, down the back of the neck, allowing those muscles to relax as well. Feel it continuing to flow down the middle back, flowing down the lower back, creating a wonderful cascade of relaxation all the way from the upper back to the middle back to the lower back. Feel that liquid as it flows down over the shoulders, allowing your shoulders to sink and to relax, flowing down through the upper arm muscles, through the elbows, through the forearms, through the wrists, through the hands, through each of the individual fingers, leaving your arms totally and perfectly relaxed. Feel that liquid as it flows down over your chest, allowing the chest muscles to relax, cooling in the hollow of the throat, where we often carry tension in our bodies without being aware of it. That any tension that's there simply disappears and is replaced by that precious liquid. Feel it flowing down over the sternum, over the ribs, allowing the muscles surrounding those to become calm and peaceful. Feel it flowing down over the abdomen, over the sides of the waist. And once again, visualize, see in your mind's eye that that liquid is not only on the surface of the skin, but that it penetrates through the skin, through the muscles, into the very organs themselves, creating a wonderful sense of relaxation and calmness all the way from the very core of the body, radiating outwards. Feel that liquid as it flows down over the hips, through the thighs, allowing those to become calm, through the knees, through the shins and the calves, through the ankles, through the feet, through each of the individual toes, leaving your entire body relaxed and calm and peaceful. And as we begin our work, you should hear certain sounds, dogs barking, people talking, papers rustling, whatever it happens to be, that's okay. Because the more you hear those sounds, the more you'll concentrate on the sound of my voice. And the more you concentrate on the sound of my voice, the deeper you'll go into a wonderful state of relaxation and calmness. So now, if you would, I'd like you to visualize once again, see in your mind's eye, to imagine that right in front of you is a door. On the other side of this door is a beautiful tropical beach. On this side of the door, you may experience anxiety, stress, discomfort. But once you walk through that door to that beautiful tropical beach, the only thing that you'll experience is relaxation and calmness and peace and tranquility. So if you would, imagine that you're reaching out, opening that door, stepping foot across the threshold into that warm, deep sand on the other side. And as you pull your other foot across and close yourself in that place, immediately you feel a wonderful wave of relaxation and calmness and tranquility just wash over you from head to toe. Because that's the only thing that exists in this place. All those other emotions are on the other side of that door. You've left those behind. And as you go through this place, the more you can imagine these things, the more intensely you can imagine your experience of them, then the more effective it'll be for you. So if you would, imagine that you're walking down to the edge of the surf, to the edge of the water. And you may notice that as you walk down there, that warm, deep sand that you're standing in is a little difficult to walk through, but the closer you get to the water, the more firm the sand becomes. And once you're at the edge of the water, you're standing there, and as you look out, you may see the waves, you may watch them curl in upon themselves, you may hear them as they break, you may see that white foam on top of them as it rides in up the beach, over your feet and up the beach behind you. And as the waves recede, as they're pulled back into the ocean, you can feel that little bit of sand pull out from beneath the bottoms of your feet, as it does when you're standing at the edge of the surf. And every time you feel that water wash over your feet, and every time you feel that little bit of sand pull out from beneath the bottoms of them, any remaining stress or tension or anxiety that may have snuck its way in here is simply pulled right out the bottoms of your feet, dispersed into nothingness, into that deep blue sea. And as you stand there, you may be aware of other things. Maybe you can sense other things. Maybe you can feel the warm sun on your skin sinking in all the way to the very bone, causing you to feel even more relaxed and more calm and more peaceful than you were just a moment ago. Maybe you can feel a slight breeze as it blows in off of the sea. Maybe you can feel that on your body. Maybe you can hear it rustle the palm trees behind you. Maybe you can even smell the salt on the air, taste the salt on your lips. And as you look out toward the horizon, past where the waves are breaking, you can see where the blue of the sea meets the blue of the sky. And as you look up in that blue sky, you see those white puffy clouds that are just floating there. They're so relaxed and so calm. And I wonder if you can allow yourself to become as relaxed and calm as those clouds are. I wonder if you can allow yourself to just float there among those clouds for a while. And as you float among those clouds, maybe you can even look down and see yourself still standing at the edge of the surf. Maybe you can even still feel the water washing over your feet. Still feel that little bit of sand pulling out from beneath the bottoms of them. But floating there among those clouds, so relaxed and calm and peaceful. And now imagine you're back on the beach once more. And imagine you're walking down the beach. And as you walk down the beach, you're still at the edge of the surf, still allowing that water to wash over your feet. Still feeling that little bit of sand pull out from beneath the bottoms of them. And as you walk along, you can see different things, different kinds of shells, some scallop shells perhaps, some conch shells even, maybe bits of seaweed, maybe some terns nested in the sand up ahead. Maybe you can even see some seagulls that are floating on the wind. Maybe you can even hear their laughing cry. And up ahead of you, you see a small boy who's writing in the sand with a piece of driftwood. And as you get closer to the boy, you notice he's writing numbers in the sand. And whatever number the boy writes, you're going to stay one number ahead of him, going backwards in your mind, forming that number in your mind, tracing it on the backs of your eyelids with your eyes over and over again. And the lower the numbers go, the more relaxed you'll become, until by the time you reach 0 in your mind, you'll be in a perfect state of relaxation, a perfect state of calmness, a perfect state of tranquility. So now as you get close to the boy, you notice he's writing a 5 in the sand, and in your mind, you're thinking 4, staying one number ahead of him, going backwards, forming that number 4 in your mind, tracing it on the backs of your eyelids with your eyes over and over again. Already more relaxed and more calm and more peaceful than you were just a moment ago, knowing that by the time you reach 0 in your mind, you'll be in a perfect state of relaxation and calmness. So now the waves come in and they wash away the 5, and the boy writes a 4, and in your mind, you're thinking, making that number over and over again, more relaxed and calm and peaceful, knowing that by the time you reach 0, you'll be in a perfect state of relaxation and calmness. And I wonder if on the next number, you can allow yourself to become 20 times more relaxed than you are right now. So as the waves come in, they wash away the 4, and the boy writes a 3, and in your mind, you're thinking, making that number over and over again, now 20 times more relaxed than you were just a second ago if you allow yourself to be so, knowing that by the time you reach 0, you will be in a perfect state of relaxation. And I wonder if on the next number, you can allow yourself to become 40 times more relaxed than you are right now. So now as the waves come in, they wash away the 3 and the boy writes a 2, and in your mind, you're thinking, now 40 times more relaxed than you were just a second ago. If you allow yourself to be so, knowing that by the time you reach 0 in your mind, you'll be in a perfect state of relaxation and calmness, a perfect state of tranquility. So now the waves come in, they wash away the 2, and the boy writes a 1, and in your mind, you're thinking 0. Now in a perfect state of relaxation, a perfect state of calmness, a perfect state of tranquility. And just for a moment, allow yourself to dwell in this place of relaxation and calmness. Allow yourself to experience that tranquility. And now in just a moment, I'll count to 5. When I reach 5, you'll open your eyes feeling relaxed and refreshed, feeling absolutely wonderful. We're at 1 now, feeling relaxed. We're at 2, feeling relaxed and refreshed. We're at 3, feeling relaxed, feeling refreshed, feeling absolutely wonderful. We're at 4 now, starting to come back to awareness wherever you are in time and place, what will surround you. And now we're at 5. And whenever you're ready, you can open your eyes feeling relaxed and refreshed, feeling absolutely wonderful. Okay, I hope everybody enjoyed that. Okay, that's just an example, one little example of some guided visualization, some progressive muscle relaxation that happens there. Like I said, you can go on YouTube, find hundreds, if not thousands of examples of those. Some of them have wonderful music. I wish I could play some music for you. There's some that have some very nice music out there that goes along with all of that as well. This is something, well, we took a little longer than 2 minutes to do it, but just 2 minutes of mindfulness practice can be efficacious for us. So certainly if we spend 5 or 10 minutes on it, that's going to help us as well. Okay, all right. So before we get to the questions, if you have any questions, please feel free to ask them. I am Dr. Ron Mottern. You can reach me at these contacts there. Once again, the slides will be available to you. The appendix there, that has the relaxation response, the autogenic training, the cognitive restructuring by Byron Katie, that's there as well. And after that, we just have some references for anyone who may be interested in those. Let me get down here, lots of references today. I'll get down here to the continuing education part, and I'm going to stop sharing. Well, I won't stop sharing my screen right now, but any questions that we have, any questions that we have, be happy to answer them right now.
I think that the biggest thing that people have been, which I have never heard before, is the diabetes 3.
Yeah,
and Alzheimer's, and there's several comments, and then some people added some more information. But I think that intrigued several people on here.
Yeah, you can look at that. You can look that up online. That's being Alzheimer's is being referred to as diabetes type 3 these days by many physicians. So please feel free to look that up online. At some point, maybe we can have a session on that. But like I said, that'll be something to look up online. Yeah. That'll give you more information than I can right now.
We absolutely will do that. That's great. That's a great topic. Someone asked if you could repeat the YouTube for cognitive restructuring. The name of on YouTube.
Yeah. Right. Yeah. Byron Katie. If you just go to YouTube and put in Byron Katie, her videos will show up. She does what she does is cognitive restructuring, her own version of it. you can do that. I provided that a link to her stuff in the appendix as well. So you can look on YouTube, you can see her practice that stuff. If you look on our website, the link I have shows you the stuff, but it's also, then you can go on YouTube and watch her actually use it, okay, see it in motion. So that was that. And I also see there was one on where can we learn emotional freedom technique. If you go, once again, YouTube is your stress management friend, okay? If you go on to YouTube and look for EFT or emotional freedom technique, lots of videos out there that will teach you different aspects of it. The Ortners are out there. Nick Ortner and his brother and his sister all do that. They have a World Tapping Summit every year online for how to tap for different maladies and things like that. Gary Craig is also on there. Gary Craig's the one who invented EFT. So he has some videos on there where he goes through what's called the basic recipe for it. So you can learn that certainly on YouTube will give you a good thing. There's probably some, every now and then there's some professional organizations that offer training in this and using it for specific things. Those are out there as well if you get the flyers from the professional organizations. Otherwise, you can just go on YouTube and watch that.
Very good, very good. Does anybody have any other questions? I will go ahead and go over the CEU stuff. Will you guys have a chance to put anything else you would like to ask in the chat, if you would? But once again, we're providing CEUs today, 1.5 classroom hours for licensed social workers and licensed professional counselors in Texas. Those of you outside of Texas, again, I've had people talk about the fact that they can take the certificates and have used them. That depends on your jurisdiction. Obviously, there's no guarantee of that. For those of you that would like a certificate of attendance, we do those as well, and really the guidelines are exactly the same. You must complete the entire webinar. Don't miss more than about 5 minutes, 10 minutes at the most of the webinar. I did see someone talk about the fact that they'd been kicked out and came back in. That does happen. Those will be, anytime you're on, it will be reflected in the report we get from Zoom that actually reports how many minutes, but it'll show that you've gone off and come back on again. We're really looking at the total number of minutes that you're on. If you're joining us by phone, and that's the only way you're joining us, and you're looking at maybe the slides from the PDF, if you will email me the phone number you were on with and your name, so I can correlate those two, because for a few of you that are only joining us by phone, the Google report will only tell a phone number. It won't give me any additional information, and so I won't know that you were on. But you also need to complete the Google survey that should pop up as you close out of Zoom. But if it doesn't, you will also receive it from the follow-up email that I will be sending out tomorrow morning on this. I'm a little bit behind from yesterday. I had a couple crises that I had to deal with this morning and last night. But I will get those out to you, but you do need to complete those. I will say for future webinars, I'm going to ask, just for those of you that join us a lot, if you try to use the same name and put your full last name when you register, so that it matches the Google survey. What you put on the Google survey is going to be what we put on the certificate, but it helps a lot if you registered under the exact same name as you put on your Google survey, because then correlating them together makes it a whole lot easier. So I'll throw that out. Doctor, I don't know, is there other things that you would like to address that are coming up here?
Let's see.
Marilyn, could you please email me that? I can check on the CEUs. If you're missing any CEUs prior to 2 weeks ago, for events that happened prior to 2 weeks ago, if you will send me an email, because I can check your email address and it'll just pull up what's been sent out, and I can just forward that to you again, or research why you haven't received them.
Okay. I see somebody has asked for if I have any guided visualizations online anywhere. You can go to my website. I have some things on there that that might be interesting to you. Also, more on the Alzheimer's and diabetes. People, I don't make this up myself. I get it from physicians. You know, go to Google Scholar, look it up online. I refer you to the experts on this, okay? Because I'm not a physician, I'm a psychologist, but this is what I'm seeing in the research. So I encourage you to, you know, this is where we sort of started on this, right? With the pandemic and everything that's going on, and we sort of have to do our own research on this as we go through that. So I encourage
you'll see me get off. You look forward to our webinars. We'll be doing something on that because I have not heard it before either, and we'll definitely bring that to you.
Okay, did I get everything? Did I miss anything here?
Marilyn asked if they need to complete the survey and it didn't pop up. Once again, you'll get that in the first follow-up email that I send out after every webinar. I include that link. I think. Do folks need a license to use biofeedback equipment?
No, no, not at all. You can get those, like I said, online. HeartMath is one of those that usually comes with a little explanation on how to use that for their particular product. Don't have to have any sort of license for it. You can go online, you can buy those. Like I said, there's many of them out there. You can order some on you know, Amazon Prime and have it tomorrow if you needed it. So those are out there. You don't have any necessarily have to have any type of special training or anything like that. I see there is a question on, is EFT different from EMDR? Yes, it is different. EFT is the emotional freedom techniques. That's the tapping. EMDR is eye movement desensitization and reprocessing. That's where you're sort of watching a finger or watching they have wands these days with a little light on the end of them. And really that recreates the eye patterns in REM sleep that helps us to relax so that we can then go through and talk about our problems. EMDR was developed as a part of cognitive behavioral therapy. And as we're doing the therapy and somebody, especially with something like PTSD, they have a very difficult time talking about it, get very intense, start to have a reaction to that. You can do the EMDR that will help the person calm down, where they can then process whatever it was that was going on with them. So two very different things there. Another question there in the Q&A.
I just
okay.
Go ahead.
How can yeah.
Go right ahead.
Yeah, it's you know, it's always a task to try to figure out how we implement these things into our lives, especially like you said, in geriatric populations which have you know, special needs and things like that. How do we do that? You know, it's going to be individual, right? Because everybody's going to have their own individual hurdles and their own individual circumstances. But I think the best thing is that when we actually know what some of the things we can do are, something like tapping, right? Now, you know, a lot of this falls off when we're dealing with things, we're dealing with dementia and things like that, right? But if we're dealing with just an aging population, an elderly population, something like that, then many of these things can be implemented with them, but they've probably never heard of them, right? Unless they stay up to date with things like this. So just introducing them, the tapping, especially things like that, and what have you, those are things that we can, you know, the diaphragmatic breathing, these sorts of things that can help people. I hope that sort of answered the question. I'm not sure that it did, but you know, a provider can present these things to the client, and there's a lot of them out there, a lot of evidence-based practices, and find one that the client likes, and then help them implement that into their lives. I don't think I answered your question. I'm sorry, but that's sort of what I got. Sort of what I got out of it right there.
Just so you know, I put Dr. Mottern's his website and his email address in the chat as well. I know you'll have it in the slides, but I just added it to the chat in case you're looking for that. Marilyn, and I apologize if there was any misunderstanding about that. I'm not worried. If you've already registered, obviously, for this one, and it's going to be different, I try to correlate those together. Some of them are easy to do. Some of them are harder to do, to correlate. And that's why I'm just asking you. It just makes it a whole lot easier. I've set up a system so that I can get the CEUs out quicker. And that system actually looks from one to automatically looks it up. And so if it doesn't find it, it creates issues with that. But so I was just kind of saying for future webinars, as you sign up, if you use the same name as you want on your certificate as well. But I should be able to figure it out. For today, I've been able to do most of them up to now. So thank you so much for that. Dr. Mottern, thank you so very much. Exceptional.
My pleasure.
As
always, my pleasure.
Thank you very much. Thank you all for joining us. I hope you all have a great day. Also look forward to the second follow-up email that will have a link to the recording of today's session that will upload to YouTube, that you can share with all of your family and friends, and that should be able to help them as well. Take care, and you all have a great day.